I just went to the doctor like 2-3 weeks ago, when I says, I think I'm going into perimenopause. And she was like, okay, we'll look into it. And all your blood levels are fine. Maybe you should talk to your OBGYN. So they always defer it to someone else.
My doctor has never brought it up. Any symptom I've ever had, it's like, you're old,
They'll ask me if I'm in menopause, and I'm like, I don't know. I don't know. Am I? Do you give me a blood test, or how am I supposed to know?
Do I talk to my primary care physician? Do I get a hormone specialist?
Looking at, OBGYNs, thinking that they would know more about it as well, but I learned that that was not the case either.
So I feel like nobody wants to talk to me about it.
Sometimes you feel like you're dying from every symptom, but you don't realize that you're okay. But we're not educated in menopause and what to expect.
I've had to learn all of that on my own.
For me, everything that I've learned up to this point is because I'm an avid reader.
You did it on your own.
I think I started perimenopausing around my late 30s.
Me too. I did too, and nobody would believe me.
No one knew. And then I've been in full-blown menopause for about 3 years. It's been really rough, and I was dizzy. And I went to the doctor. I'm like, is something going on with my brain? Like, I'm off balance. And so once she did the blood work, she's like, oh, yeah, you're in the throes of menopause. And that was it. And she let me go.
That was it.
That was it. She offered no assistance.
And for me, I went to the doctor and I said, and it was a guy, and I said, I think I need some hormones or something. I'm going through menopause. And he said, I can't help you. And I said, well, what do you mean? Like, you're a doctor. And he goes, well, we didn't really learn a lot of this in medical school. So he goes, you're gonna have to go see someone else. And I go, well, you don't, he goes, well, we do a day of gynecology in medical school. I can't help you. I'm not equipped. So I also had to do my own reading and try to figure out how to help myself.
I can tell you I've been practicing women's health and internal medicine for 32 years now. I promise you, doctors are trying their best to take care of patients, but when they don't have training and they don't know, they kind of pat you on the back and say menopause is normal, or take some supplements, or turn your air conditioning up, or it'll pass, without really addressing the fact that these are incredibly, significant symptoms that many women are having.
What percentage of doctors are trained or certified in treating menopausal patients?
The number's staggering. There's only 1,600 people who actually are certified, right? 1,600 clinicians. But compare that to 300,000 primary care doctors out there, 30,000 OBGYNs, and we're talking about 0.5% of doctors really have any formal training in menopause.
So what would you tell someone who's starting their menopausal journey? What kind of tips do you and Dr. Larkin have?
I say first you need to be your own health advocate, because you're going to get a lot of advice and resources and stories, and it's going to feel very confusing. Getting prepared for a doctor's visit, writing down some notes or questions, and doing a little bit of research first. I think that's important.
I have to write it down, otherwise I'll forget all of them.
We might forget, yes.
If you're having symptoms, recognize that they're real. And like you would do with anything else, don't take a pat on the back and you'll get over it as the end-all answer. And you really do have to advocate for yourself and really find a provider if you're not getting answers, in the same way that you would, find a specialist for your other health needs.
So physicians who are trained, it will say that they are menopause certified.
It's a menopause certified practitioner. And I think the greatest thing is to see that really the tide is changing, and there's a lot more interest flowing into the space. But I think what I'm seeing is it's the younger generation who are saying, okay, this is just not acceptable anymore. They are driving fundamental healthcare change, and we need fundamental change in the menopause space so that we can provide better care to women across the board.